Testing, testing, testing. Testing. Hi, everybody. I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with facial balancing as well. I'm going to walk you through this particular case. We have a long form video as well on our page. You can watch the whole process. This involved a few different steps. A lot of it was with manual procedures such as excision. We did an elliptical excision in the cheek area, also in the temple area. We also did a CO2 laser for the thicker parts of the scars. We also had done some Bellafill as well. This patient now at this point is about 6 to 8 months out, and you can see significant improvement of his skin, significant improvement of his scars. So take a look. You can see when we're looking at patients like this is a patient who is Fitzpatrick 4. We had to be really careful with his pigmentation, and so that's why we didn't just rely only on lasers and energy devices. We had to really make sure that we tackled every aspect of his scars, and we did that by undermining some of the scar tissue with Subcision. We took out the wider scars, made it into a more narrow, more superficial scar. And then we also did the TCA Cross, which is an acid which we placed directly at the base of each of those individual boxcar scars and ice pick scars. I even did in some of the rolling scars as well. And we had to do a few times really for volume replacement. He needed a lot of volume. He had a lot of fat destruction. He's a young gentleman just in his 20s, and he did have a lot of fat loss really. So it took a few steps really, but it's awesome improvement. We'll continue to improve. I placed some more Bellafill in this patient now at this point when he came in, and you can see there's going to be continuous improvement for his skin. At some point, I'll likely actually try to do more laser for him once we're going to be able to do that, and he has some downtime for that, so we'll do a little bit more laser for him as well. So really cool. You can see, look at this process over here. He's somebody who comes on also on here every once in a while, so I'm not sure if you're on tonight, but if you are, just give a shout out. But yeah, this is it's cool. You can see, look at that process. This is after the one single combination session, and then we did do a little bit more Bellafill for him afterwards, and so you can see it's going to continue to improve over time. We will continue this journey with this patient. When he has more time for some more downtime, we'll likely do another laser for him. That's going to be awesome. Really, you can see a lot of that fat destruction in the temple area improved a ton. So look at that. That whole temple area, really, he had lost a lot of fat really quickly because there's not much fat to give in that area. So a little bit of scarring over there sometimes could destroy the fat really, really quickly. How much is Subcision? It depends. It's about $800 usually to maybe up to $2,000 or so, depending on the complexity of it, depending on how deep the scars are, and the areas that are involved on here. Let's see here. Ellie Gonzalez is saying, using hydroquinone hasn't worked for my dark shaded surrounding my mouth. What else can I do? So that a lot of times that kind of shade is a lot of times more due to hormonal, something potentially like melasma. It could be a reason why that's what it is. And you may need something like maybe like a triple cream, something potentially like a triluma could work well. But it's possible also you may need to do something more with like lasers, or you could do something with tranexamic acid as well, like oral tranexamic acid. Depends on how serious it is. Depends on if there's like vascular issues that are also underneath there. Too much blood flow to those spots can also cause that as well. If a hyperpigmentation mark is not gone after 6 months, is it permanent? No, not necessarily. It's possible that you may not have done all the right treatments for it. You have to do other things. It may have to do some things really to improve the pigmentation that aren't really by the book sometimes too, like pigmentation. Any reason why multiple subcision is not showing results? Also, is CureJet treatment worth it? So multiple subcisions, so it depends on who's doing the subcision. That's really the biggest thing, is that it's operator dependent. But subcision isn't going to solve the fat loss issue. So this patient, for example, he had a lot of fat loss, a lot of volume loss. If we did just subcision by itself, it really wouldn't have changed much. I did the subcision just so I could be able to place the volume afterwards. So people that opt not to do volume replacement aren't going to really get that significant improvement after you do subcision if there's so much fat loss. It's like, what are we really going to be able to do? We break up that scar tissue, but it's just going to sink back down, not necessarily be pulled down, but it's going to sink back down because of the fat loss. So you have to do something for that fat, whether that's fat transfer, whether that's Bellafill, Sculptra, or Radius, or if you just opt to do just, potentially something like hyaluronic acid filler, that may be the other option. So yeah, as Sailor Moon says, it's possible that it's bad work. It's really, I've seen so many times over and over again where people say that they've done subcision and they saw that they did it really well, but it just wasn't done properly. You go in there's so much scar tissue as well in there. Actually, one of my patients today, a lot of scar tissue in there. She had done subcision a couple times before. There was so much scar tissue still there. Hi, Maine. How's it going? Good seeing you on, by the way. Ems Gems is saying, why does subcision sometimes cause sagging? How to avoid the sagging? So it's possible if you're in the lower part of the face and you use sharper tools, something like the Tear Liberator, for example, that could potentially cause sagging if you're doing it, if the person that's doing it is too superficial and destroying some of the ligaments there, and potentially also deep. Also, that can also be a problem. There's shifting fat sometimes that way too. So it depends on the technique and also the location of the scars. So the upper part of the face, really low likelihood of that, really low likelihood of causing real problems like this, because we want to make sure that as we're doing this, we're really in the right plane, and it's a lot easier to do that in the upper part of the face. Lower part of the face, really closer to like the jowling area. Now that ligament is really, really superficial, so just sometimes any sharp tool there could potentially dislodge that and cause fat to herniate out, be able to push out there. So something I've seen other people do, I've worked on patients before, and they had those that happened to them before. Unfortunately, a lot of times what happens though is that people that have done it on them, they combined it with something like Sculptra or Radius. They combined the subcision with it, and they did it like this dilute form where it went all over everywhere. And now with gravity, it can end up just like weighing things down. And so that's another problem too. So sometimes you have to look at it with the ultrasound, take a look with imaging to see exactly what's happening over here. Does retinol get rid of dark circles? It may not really, because it may actually trigger it, because it may make you a little bit more prone to hyperpigmentation, more sun sensitive over there. Would not recommend it for that area. What do you think of erbium laser? I have a session planned for next month. I do it multiple times a day. I love erbium lasers. It's mostly done with a combination approach for myself though, but it's great for anti-aging purposes for that. Is Phenol Peel better than CO2 laser for deep scars? Not necessarily. It depends on the kind of scars. Like if it's like a few scars, it depends on how thick the edges of the scars are. If they're more like ice pick scars, that can help enough really with the Phenol Peel. So it depends on kind of like the depth of the scars and how thick it is around the scar tissue. So in this case, you can see like there's these edges around the scar, which is relatively thick. And that's something that we would do, something to resurface. And that, in this case, I opted for the CO2 laser due to his, he already had some hyperpigmentation. His skin type is Fitzpatrick 4. There's more risk for pigmentation issues for him. So we had to be really careful. And we ended up doing it with the CO2 laser in this case. Do you like the PicoSure laser for pigmentation? Yeah, I love it. It's awesome. I do it all the time. It works really well for melasma patients, for post-inflammatory hyperpigmentation patients. We could definitely get that there. It's sometimes slower though in darker skin types. It's not something you just want to blast and just like call it a day. It takes a lot more work to go. Basically, what I do is I get the deeper part of the pigmentation first, and then I start working on the superficial stuff, and it works really, really well. Lorena is saying, what about needling on redhead with lots of broken capillaries and medium scars under the cheekbone? So I really wouldn't recommend doing microneedling in general for scars, and that goes for the other person that's asking that as well. It's not going to help too much. Sometimes it can make the scars wider. This patient, I wish he was on right now. Sometimes he comes on, but I think he did 10 sessions or so of a laser. I think it was Clear and Brilliant for him. And so he did Clear and Brilliant. He also did some microneedling sessions as well. I think all together it was close to a dozen sessions of stuff or something like that. A lot of stuff he's done, and nothing really got to nothing. These are the scars after he did all those sessions, and now we'll take a look when we worked on him. Look at where we ended up doing that. And Roz is saying, have you ever done fully ablative laser on darker skin types for full face? I would not do it even for lighter skin types, really. Vast majority of patients do not need fully ablative laser. And especially if we're talking for scar purposes. If it's more for like anti-aging, that's a little bit different. But I'm not sure why I would do fully ablative lasers in darker skin types for the full face. You could do localized areas, it makes sense, but it doesn't make sense to do a full face like that. I'm not sure why I would do that. So I would not recommend doing it that way. And especially if you're saying you're skin of color, I would not recommend doing that though. Like there's no reason. One of my patients the other day, he was on here also, and he had done like what's called ultra pulse laser, and they did it fully ablative. It seemed like, I'm not sure. I didn't get verification. He thought it probably was, and it caused a lot of hypopigmentation for him. And I saw him like 3 months or so after he had done that procedure. So there's a lot of hypopigmentation still, a lot of hypopigmentation. And there's like clear demarcation where they did the laser, and it's like with his regular normal skin type, it looks really obvious. So I would not recommend doing things like that. It's risky. Also, it can make scars worse or make the skin worse. So instead, just localize area. That's the thing. That's the way to do it. Localize area. The areas where it's thick around the edges, that's where I use that ablative form of CO2 laser if it's needed. What do you recommend to the skin of color with acne scars and dark marks? So a lot of times actually solving some of that hyperpigmentation is going to make a huge difference there. So doing that actually is a good starting point really for patients, but it depends on what kind of scars you have though. It's possible we need to do other things, potentially like a little bit of volume replacement, which is not going to be much of a problem, like something like Bellafill, for example, Sculptra, Radius, all potential options there to stimulate collagen, give you a little bit of volume. And of course, it's not going to trigger any pigmentation issues there too. And then we could tackle your pigmentation. Do, for example, the Pico laser could work really well. Denise is asking, do you still recommend Cosmelan Peel? So interestingly enough, it's they changed their formula a few months ago, and there were a lot of people get it done elsewhere, and they really complain about that. We actually have always we're actually the only practice that's allowed to have we got it done with a pharmacy actually, where we could actually add extra portion of and really compound things in there. We do it really. We get it so it's a higher level for patients for melasma. Depending on the skin type, we could adjust it. And that's what we do actually at our practice. But the newer peel that they've released has had a lot of people that were complaining about it. A lot of people. Alo saying, does Subcision require filler with a skin sag without it? No, it doesn't require filler. There's some patients who don't have volume loss. This patient, we needed it because of how much volume loss there is. There's so much fat loss. And one of the ways you could tell there's so much fat loss is look at this. This is a static image. He's not smiling, anything like that. And there's very clear atrophy. There's very, very clear that there's fat loss over here. There's fat loss in the temples, fat loss in the cheeks. And so what we have to do at this point is to really actually make sure that we could, after we do the subcision, provide enough volume replacement for this patient. Hi, Rest and Tell. How's it going? If you choose Sculptra to stimulate collagen, do we need to get it every 2 years? Well, the collagen part you get to keep for several years. It's the volume part that does go down. So you do want to do some little bit more for volume as you get older. Joanna is saying there's not much information on sanding with actual sanding paper. What is the aftercare? So you're going to have open wounds over there. It depends on if they did it with a Phenol peel or without it. I usually do it when I do the Phenol peel. The next day we do Phenol. Basically, we do Phenol the first day in the OR setting. Make sure the anesthesiologist is watching the heart, everything's safe. And the next day, I will use sandpaper to actually smooth down the scars, all the thicker edges of the scars. We're going to smooth that down with sandpaper, which is really cool actually, because it's going to allow us to put some of the Phenol at a deeper layer now. So yeah, I do that actually. And that's what I recommend doing. But what I always like to do is make sure that we want to make sure that exactly your point about aftercare. One of the biggest things is making sure infections are minimized. Really also we want to prep the skin a certain way to prevent pigmentation issues afterwards. Hi, Mrs. Jones. How's it going? Good seeing you on too. Thank you. And I think sanding works better for a lot of lasers. What's the cost? It depends. I don't think that sanding would necessarily work better than a lot of lasers. If you do lasers a certain way, sanding also has its own risk, and it could cause scars to get worse or cause more hypopigmentation. It depends on what we're dealing with. If we were doing it also with something like the Phenol peel or not, I'm not sure exactly. No, that's what she's referring to. Dermabrasion is basically, so dermabrasion, sanding, I do dermabrasion with really sandpaper type tools. I don't use the mechanical device because I do think it's really risky for that. Don't you think microneedling helps with acne scars? I think it's really minimal, if at all. This patient did a bunch of sessions for that. Didn't help enough for his scars, really. It's not going to help much for that. Emraz is saying, Dr. H consult always does fully ablative laser. What's your opinion on him? Very controversial. Well, I'm not going to get into my opinion on him. I'll just refer to the fact that I don't do fully ablative CO2 laser on the face like that. I do it for certain areas that need to be. I'm very, very precise as I do it. So let's say, for example, in this patient, there's this area where you can see there's this depth to the scar. There's this atrophic area where it's like basically like this valley. And you'll see like this area where it's thicker around it. And what I did was I basically smoothed down the thicker parts and slowly lifted up the depth also. And it takes a lot longer. It takes a lot longer to get that result. It takes a lot of concentration. Sometimes it takes me, a few hours really to keep on working at that and keep on working at that to do that. But it's a lot safer for patients. It's a lot better result for patients. A lot less chance of any issues with anywhere else in the skin. Why would I do fully ablative on the rest of this patient's skin? It makes no sense. I don't understand what the thought process is for that. And I'm not sure if he's saying he's doing the full face or not. I know he believes in fully ablative. I'm not sure if he's talking about the full face or anything like that. I'm not entirely sure what he's referring to with that. Is Phenol Peel safe? It's not necessarily safe. You have to double check your heart. We monitor your heart during the whole process. It really is reserved more for severe scars. I had a patient today who was told by somebody who did his subcision that the next step really should be phenol, and he should go find someone who does phenol. And so he came to me, but it was really mild scarring, and really what we need to do is more like focal point CO2 laser for that. So I turned him down, and it's going to end up saving him a lot of money too. It's like Phenol Peel, of course, costs a lot more, and I could get this solved with a laser. It's a safer way of doing it for him. And he's a darker skin type. We want to make sure it's safe. We can still get that great result. But it doesn't make sense for me to go and do something that's high risk for something like that. It's not worth that risk because of the chance that you could lose some pigmentation if you do that way. It's not like a high risk of losing pigmentation, but there's a chance. It's not worth it for us if we could get the same result with something safer. So I'm always going to choose that. Really, if we get to the same kind of result, same kind of outcome in a safer way, why should I choose the more aggressive, more dangerous way? And it's like it doesn't matter like whether the cost is different. I do well in life. Like I'm just going to give you exactly what you guys need. It's like this is what you need. This is how to do it. And really, this patient he called today, and he was from Denver, and he said that he'd done some treatments before in the past and just wanted to get that like more refined look, smooth out some rest of that scar tissue. It was just like these scars are pretty mild though. It's just I don't know why it would be even recommended in his case. Well, I know why, because the person that recommended it doesn't do that much of the laser really. They don't use the laser that way. They don't do much of laser at all. They don't even really believe in laser that much. And it's like you have to do some laser sometimes for patients where there's thickness around the scar. You really have to smooth it down. But the thing is that they don't teach laser that way. Nobody does laser that way. They don't teach it that way. I'm teaching people this way. I'm showing everybody how to do it that way. I'm doing it so that you could showcase that you use it with almost like a surgery and do really precisely around the edges. It works very, very well. Can you do localized Phenol Peel and not the whole face? Well, you're going to really have a high risk of a line of demarcation with a Phenol Peel that way, meaning you're going to have different color skin tone, potentially that some areas going to be a little bit different depth compared to other areas. I would not recommend doing it that way. Is Sculptra the same as filler? I don't want filler. If Sculptra is in this biostimulatory category, so things like Radius, Sculptra, those are in biostimulatory categories. They give some volume, but they're not really fillers. They're stimulating your own natural collagen response. Bellafill is also in that category, but 20% of Bellafill is a bit of a filler. So 20% of it does give a little bit of volume, and that is really good for scar purposes because even if you lose a little bit of weight, you have some improvement of your scars. It's always going to support that. What to do to prevent future acne scars? The biggest thing is just going to be to control your oil before we do the procedures, control your acne as well so you don't run into problems in the future. That's really the best thing to do. Do you think microneedling is beneficial for acne scars? Really mild. Vast majority of people don't get much improvement. I didn't get it really much improvement at all. I pretty much don't think I got any improvement from microneedling. Does Phenol Peel have side effects on the heart? It's not like it's a long-term side effect, but just while you're doing the procedure, there is a risk of cardiac toxicity. So what that means is that it could potentially cause irregular heart rates, arrhythmias. And so we have to be very, very careful, which is why I have patients with the anesthesiologist who's monitoring the heart throughout the whole process. I don't have to worry about the heart that way while we're doing the procedure. I could focus just on the phenol portion of things, the mask part, the peel part, and then what we end up doing is we then the next day we'll do dermabrasion. So I sand down the scar tissue, and then we may place a little bit more of that phenol in the deeper parts of the that we sanded out now. That works out really well. That's a lot safer than doing it just in the office, where if you're not having somebody who's monitoring the heart and you're doing both the monitoring of the heart and the peel. That's a lot more risky. So that's how it's safer. But there's not like a long-term risk to it like that. Let's see. Majid is saying, "I'm from Saudi Arabia. Is phenol right for me?" I doubt it, really. I doubt your skin type is right for a phenol. There's probably better options there instead of doing phenol. Imraz is saying, he did fully ablative laser on me and caused pigmentation. It took me 4 years and 5 picos to clear. Yeah, I'm sorry to hear that. Really, at least it was hyperpigmentation, not loss of pigmentation. So it did end up resolving pretty well. Even hypopigmentation, that loss of pigmentation usually resolves, but it's just more of a challenge though, and there's more involved with it. The Pico laser can work very, very well for hyperpigmentation. So to your point, I don't agree with doing full field ablative CO2 laser. I also disagree with many people who say to do full field subcision or with Taylor Liberator. I don't do like a subcision for the full face, and you'll see it over and over and over again. They're doing full field subcision, and maybe for some people, the person that they were doing it on, it was like 100% necessary. But I do so much of this. I do 3 to 4 cases every single day. And I don't know when I would do that. Every case that I do, it's like, even if there is scarring over here, I still localize it to those areas. So over here, I'm coming in and breaking up the scar tissue, and some of these areas will use different entry points to break up some of these scar tissues. But I don't have to go in just from one side and just start doing this windshield wiper type of approach. And sometimes they're going too deep when they're doing it, and they're displacing some fat. And there's that problem, which I really want to make sure that we preserve your fat, because as we're doing any of these kind of procedures, fat loss is causing some of your scars to look a lot worse. So we want to make sure that your fat is just really supporting the scar tissue that's there. Let's see here. What do you do for gray-black hyperpigmentation for brown Indian skin? Were you originally on anything potentially like hydroquinone, for example, or anything like that? Jen is saying, is CO2 required in addition to subcision for minimal acne scarring, or can subcision be done alone? No, CO2 is not needed, no. And sometimes I may do some other treatment or just a different laser or no laser at all. It depends on what we're looking at. But it may not be that you have to do subcision by itself either. Maybe you have to do some volume replacement. So that's one thing that we have to see. Sometimes you do the subcision first, and then later on you do a little bit of the a little bit of volume replacement later on, or even do some of that day, depending on what's happening there. Is subcision possible in the glabella area? Yeah, it is possible. I do it probably 2 times a week or so. Just go in there and break up sometimes basically that line that essentially ends up having this, it looks like a scar, it feels like a scar. Sometimes you do have to actually break up that with subcision. And it works out pretty well. The one thing is that that's an area that you do really need to make sure you're doing Botox on there, so that way you don't get that contraction again as it's healing. So really make sure you do that. Can you do CO2 laser after you had fillers done? Yeah, absolutely. There's no problem with that. Does hydroquinone work for boxcar scars? It's for the hyperpigmented areas, not for the scars themselves. Not going to change much for scars themselves. Which laser is best for red acne marks and some deeper scars? So V-beam is good. I don't use that. I use XLV. I like it because for darker skin types, there's less chance of pigmentation issues. It's got great contact cooling. And it's kind of interesting. It's I personally think it's the best device that particular company made. That company apparently just declared bankruptcy. So, it doesn't seem like they're going to make any more devices. PicoSure declared bankruptcy just a couple weeks ago. And, they had one good device, and actually it was really good, which is XLV. And so it's kind of too bad because I like that device. And but that's a good one. And you could also do Derma V also too, which is another possibility for vessels. I don't have Derma V, I have XLV. SBB KBB is saying, after TCA Cross, TCA only, no other procedures. Is there any specific aftercare needed? When can we go out in the sun? You may have, that actually follows up with Timber's question too. How long do you have prolonged redness after TCA Cross? It's really pretty mild redness. I don't use high concentration at each spot. So some of the deeper ones, sometimes you don't even get frosting at each spot. It's actually okay. You don't have to get frosting with TCA Cross. It's not true. But what you do, and when I'm doing this, I really want to make sure that we're using the right concentration depending on the scars. And so sometimes the more superficial scars, we use a lower dose of that acid compared to the deeper ones. And that's how we would do this without causing problems. Babe is saying, hyperdiluted radius for mild lax skin on thighs, effective for tightening skin. No, that's not going to help much for that area. I would say that that's not the good option at all. I think probably better would be something like some sort of radio frequency microneedling device. I have Morpheus 8 over here, but really you could consider almost any of the radio frequency microneedling devices that are out there on the market now. There's a lot of them that are optional. Can only microneedling help deep scars? No, definitely not. That's definitely not the case. I would not recommend that. How helpful is microneedling? So not helpful much at all. Is a biorepeal that loads of estheticians do actually beneficial? Not for scars, not going to help much for that. Is dissolving filler dangerous? I do it multiple times a day. I do it under ultrasound, just go right in the spot. If we need to, just go right there, and actually dissolve it. And it works out really, really well. It works incredibly well. I think it's much worse actually for people to have a filler that's displaced, that's in the wrong pocket. It stretches out the skin. It could look just aesthetically poor really for people. So there's ways of doing this really precisely and dissolve it there. What if it's not under ultrasound? I still don't really think there's going to be much of a problem, really, to be honest with you, really. I think it's low likelihood of any problem with hyaluronidase. I'm aware of what people say. I think that a lot of times it's just really, I think a lot of times it's because the filler has displaced the skin and stretched out the skin. And that caused a lot of consequences for you. And so if you end up dissolving it, sometimes you do see volume loss now, but it's because it was just in the wrong area. It was in the wrong part of your face, and it was stretching out your skin. Is Potenza or Morpheus 8 better for tightening mild laxity on the thighs? I think they're probably going to be pretty evened out. I get good results with Morpheus 8. But I'm open to Potenza. I think it's a good device actually also. So I like Potenza also. So I can't really say anything negative about that either. In fact, I'll probably end up switching over to a different radio frequency microneedling device just because of where certain devices are made, things like that. Thanks, Miriam. Appreciate you. Let's see here. Where was I at there? I missed a bunch of things here. Kevin saying skin pen would be able to help that skin a lot. It will not be able to help this skin a lot. This patient did 10 treatments of microneedling and clear and brilliant did not help much at all for him. What actions did I take for this patient? So we did subcision, where we went inside and broke up the scar tissue. We did excision, so we basically took out the scar and then made it into a more linear scar. It was a narrow, more linear scar afterwards. We did that for the cheek, also for the temple area. We also did ablative form of CO2 laser for the thicker parts of the scars. And then we also did a little bit of Bellafill as well. So we did a few different things actually there to improve the scars. And you can see it's a really significant improvement. We're working again. I haven't seen him in a while, although he came on pretty recently, a couple weeks ago, I would say. And he also messaged me because one time we put it on our stories like, hey, that's me looking great also. And he's really happy with everything. And he's been, I think this is about 6 to 8 months ago. It's looking awesome. We just have to continue to do a little bit of volume and place a little bit more volume in the temple area. So more TCA, a little bit more acid, and then likely some more laser to resurface, and that'll help out a ton. Does hydroquinone cause rebound hyperpigmentation? Do you have to use it for life? It could cause that. Yes, you definitely want to be on something else to suppress pigmentation. You could try, when you're off of the hydroquinone, you could try Eucerin's anti-pigment cream. That could be something to consider because that can maybe potentially help you out, and do that combined with a topical retinoid. That's a great combination there. I'm going to be done in just a moment here, so let's see if anybody else has a quick question here. And good seeing you on, by the way, Miriam. Rachel Sanford is asking, do you offer payment plans at your clinic? Yeah, we accept almost everything. So just take a look. You can see our page. For those who don't know, just go to our page at drkazi.com. You can schedule a consultation that way. Our prices are on there as well. Things are really clear for everybody. So you can just see exactly what we do, how we treat this, and really what we do to make sure we can get the best possible results here. I see a bunch more questions here. So I will see you again tomorrow. I'll be back on here again tomorrow night at 9 p.m. Pacific time. All right, thanks again, guys. Take care. Have a good one.